Hello, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate, and I'm thrilled that you're here with me tonight because we're going to be talking about one of my very favorite subjects, and that's the 5 dimensions of healing, of wellness. Now, you got to know that way before I became known as the medical advocate, I had a keen interest in health, wellness, and prevention. In fact, as early as the mid 90s, I had to write my first brochure. And I had to come up with this quote. And I came up with a quote that said, "Wellness is more than the absence of disease. It's the attainment of vibrant health." I don't know where I got that. I liked it. It resonated with me. And to this very day, I still use it. So I kept going from there and got really involved with wellness, prevention, nutrition, exercise, and got involved with the anti-aging movement, did a fellowship in that. And then in 2000, I came out with my first wellness retreat. It's called The Power of Healing, New Tools for Healthy Tools for the New Millennium. So I used the millennium as kind of a metaphor for change, because what I wanted to do was to bring about a more integrative, holistic way of dealing with health. And I've just kind of grown from there. And I had to give a couple of talks during that particular time, which is over 21 years ago. And so I came up with what's called the 4 quadrants of healing. There were only 4 back then. So they were basically physical well-being, mental well-being, emotional well-being, and spiritual well-being. And that's where it all began. But then about a couple of years later, my eldest daughter came to me. She says, "Dad, you left one out." I said, "What do you mean?" She said, "You left out social well-being." I thought about it. "What do you mean?" She said, "Well, like the song, people who need people are the luckiest people in the world. We don't live in a bubble." I thought about it, and she was right. But it kind of screwed up the name of what I was trying to. I couldn't use the word quadrants anymore because there were 5 things. So I changed the dimensions, and this has been with me ever since. So let's break it down into the 5 different dimensions. Number 1 is physical well-being, and this is really the one you really think about when you're seeking attention from your doctor, nutritionist, chiropractor, a medical provider. And so my question to you is, how do you assess the current state of your health? And I mean, do you go to a doctor once a year for a physical? Do you do lab work? Do you do your typical colon screenings, mammograms? What do you do? What questions do you ask? And it's really about asking particular questions. Like, for example, are you being screened for diabetes? I don't mean just knowing what your fasting blood sugar is. Do you know what your fasting insulin level is? Do you know what your A1C is, your hemoglobin A1C, which tells me how well your blood sugar has been controlled for the last 3 months? That's really important to know. Your thyroid. Oftentimes people will become hypothyroid as they age, women more than men. It's nice to know that before you actually become outright hypothyroid. It's an easy test to do. C-reactive protein. Those of you know me that I'm big on inflammation. And I want to know, is there any inflammation going on? Inflammation is normal when we're fighting an infection, when we have a particular illness or an infection. But people are walking around 24/7, 365 days of the year being inflamed, which is not good, because inflammation leads to the 4 major culprits of aging, which is heart disease, cancer, autoimmune disorders, and Alzheimer's. So it's really important to know your C-reactive protein level. A lot of doctors do not draw it because they don't ask for it, because it's a lot of work. And you have to figure out, well, if you do have inflammation, what's causing it? And that's a big project in itself. Hormones. Okay, now we've talked about women's hormones in the month of May, which is Women's Health Month, and then men in June for Men's Health Month. And as we said back then, hormones are not for everyone, but it's something to always consider. And being an anti-aging physician, of course, I'm biased, and I believe hormones have a big role in our overall health. But do you ever ask yourself, do you need hormones? Could you use hormones? Does your doctor ask you, do you need hormones? Gut function. Anybody knows about wellness today that you're only as healthy as your gut. The gut is now known as your second brain. So people ask me, well, what am I supposed to feel when it comes to my gut function? My answer is nothing. You shouldn't experience gas, bloating, pain, spasm, constipation, diarrhea, acid reflux. Those are all symptoms of something being wrong. We all get something every now and then. We get nervous, a little diarrhea, but these are not symptoms you should be feeling all the time. And things like irritable bowel syndrome is not to be ignored anymore. It's not a women's disease or a nervous disorder. It's now thought to maybe even be an autoimmune disorder. So these are things that are really important for you to ask. If your doctor doesn't ask them, you need to ask yourself. You need to keep a log of these functions, these aspects of physical well-being. Sleep, really important. Like when I was in medical school, I used to brag, I can get by with 4 hours of sleep. Well, who was I kidding? I wasn't good, but that's what we did back then in order to get through school, and it was not healthy. So sleep is very important. These are the kind of questions you need to ask yourself. Sexual function. Hi, people. I ask men, do you have morning woodies? Still having them? It's very important. Sexual function is a very important part of life and aging. So these are things that I look for. Now let's go to the next one, which is mental well-being. Mental well-being is really memory, right? It's really about your memory. So my question to you was, what value do you place on the clarity of your thought processes as you age? Pretty heavy, right? So, I mean, we all have senior moments. You can't remember where you put your keys. I went to the kitchen, but I don't remember why. I mean, do you have to follow a trail of breadcrumbs to figure out where you park your car? I do. I oftentimes forget it. I'm not as sharp as I was 5 years ago. I noticed that I will forget names. I will forget. There's a word that I can't quite get out. Even now. Now I don't forget facts. I don't forget medical facts, but I do forget simple little things. And that is part of aging. We call them senior moments, but what I'm more concerned about is real cognitive decline. And we don't have to sit around and passively wait for it to happen, but it doesn't have to happen. You can say, oh, well, it's in my genes. That's bull, okay? Genetic makeup is about 20% of your outcome. 80% is lifestyle. I believe that, and many people that believe in epigenetics, healthy lifestyle will agree with me on that. So, and there's things you can do to combat aging when it comes to basically losing your mind, okay? Now, we're very concerned about Alzheimer's disease. It affects about 6 million Americans, okay? And it's only going to grow bigger with my population of the baby boomers. We're going to see more and more Alzheimer's unless we do something about it. And guess what? It's not about the medication. You've all heard me talk before about this new medication, Aduhelm. I can't even pronounce it. It's so obscure. Aduhelm. I can't even find a pronunciation for it. And it's the first drug for Alzheimer's in, I think, like 14 years. And what it does, it's a monoclonal antibody. So it attacks the amyloid plaque in your brain, which is thought to be a hallmark of Alzheimer's, but it really isn't. We see it in many seniors without Alzheimer's. And so it's supposed to attach to it and kind of dissolve it, wash it away. So what you could be left with is holes in your brain or maybe even bleeding. We don't know. This one barely got passed through the FDA, barely got passed. And there's a lot of speculation about it. Drugs are not the answer. Alzheimer's is a multi-pronged disease, and maintaining your memory, your cognitive ability is work. And it's not a passive process. So it's about exercise, which increases the blood volume to your brain. It's about your diet, and we can talk about diet later. You've heard me talk about it before, but remember one thing from me, low carb diet. There's no reason to eat high carbs, especially because we know that high carbs increase oxidative stress in your brain. That's the last thing you want, okay, if you want to maintain good brain function. And there's other things as well. It's an exciting time for mental well-being. The next one is one of my favorites, emotional well-being. And my question there was, what role do emotions play in maintaining your state of wellness? Okay, have you or someone gone through an emotional grueling experience and then come down with a flu or illness or something? I have. It happened to me several years ago. I went through a difficult breakup, and I was really stressed over it, heartbroken and all that stuff. And I developed herpes zoster, which is shingles in my left eye. It was the worst. I felt like I had a left-sided headache 24/7. I never get headaches. And I felt like there was like a knitting needle piercing my left eye. It was horrible. And I actually had visual problems. I had to see an ophthalmologist every week, and actually had like I had speed bumps in my cornea. And I was lucky that I didn't need to have a corneal transplant. I got over it, and it was really bad. So this is what happens when you are if your physical and your mental well-being are they're intermingled. You can't divorce one from the other. We all have an Achilles heel, okay? Like some people, they'll get upset, they'll get sick. It'll affect their skin. They break out in rashes or hives or whatnot. Other people, it's their GI tract, constipation, diarrhea. My Achilles heel is actually my back. And back surgery was not the end all be all for me, because I've had permanent nerve damage as a result of the surgery. But even before that and after that, I had major issues with loss. It was a loss of a loved one, a partner, a key employee. There was at least 3 or 4 different instances I can tell you that within hours of the loss, I developed severe back spasm that would last me for weeks to months, before and after surgery. So that's my Achilles heel. The whole thing about emotional well-being is expressing your feelings, okay? Now, it's easy for me to do that because I'm a double Leo, right? And my feelings are on my sleeve, and you never have to people that know me, they know they don't have to figure out where I'm coming from, because I'm right out there with it. Does it make me better? It's actually a blessing and a curse, but I'm pretty open with it. But repression of your feelings is thought to be something that goes along with a cancer-prone personality. I've actually researched this. People that develop cancer tend to be more like passive, or they don't really get it out. I'm going to give you a story for a second that I want to share with you. So my ex-wife died at an early age of breast cancer. Her mother passed away of breast cancer when Nancy was 16. So when I met her, she had this incredible fear of developing breast cancer. When she would even hear the C word, she would like go nuts. So after we separated, she stopped getting mammograms, because as you get older, they find like it make you go for magnified views and things like that. Doesn't mean anything's wrong. They just want to be extra careful. She just freaked out and wouldn't go. And to make a long story short, when she was diagnosed with breast cancer, it was in every bone in her body. It was stage 4. And her breasts were encased with really like tumor. It was stone. And she wouldn't leave the house without makeup on, but from this part here, it was ignored, total denial. And I mentioned this story for a reason, not to shame what Nancy did, but this tells you how primitive denial is as a defense mechanism. And this is what happens, the emotional well-being is so important. Now, the next one is spiritual well-being. And I said, well, how am I going to define spirituality for you guys? So I looked it up. So spirituality involves the recognition of a feeling or sense of belief that there is something greater than oneself, something more to being human than sensory experience, and that the greater whole of which we are part of is cosmic or divine in nature. I like that. It's pretty nice. And so it's pretty obvious by now, and if you look at all these dimensions of wellness, is that they're all inextricably intertwined. They're not like separate entities. They work together. So to me, spirituality is living life from the inside out. We sometimes forget to do that. I think it's very important. And it's, I guess it comes down to believing in a higher power, a power greater than myself. And I'm talking about religion here. I mean, it can't be religion. Religion can be a part of it, but it's something that's just based on your own form of spirituality. Now, there are people that are atheists, and but you still have to have a higher power. I may be your higher power. You may be my higher power. Higher powers are important, because without that, there's no faith. Without faith, there's no hope. And that's what spirituality is in my book. How do I do it? I meditate every day, and I pray every day. And I'm not religious. I was brought up in a Jewish household, and I always believed in God, and it was something I had to work for. But and my prayers are about gratitude. I have a master gratitude list, and the list changes from time to time. And I try to always, I'm grateful for all the people in my life. And also, but people that are going through problems, I pray for them. And I try not to make it about me. I mean, sometimes I do, but I don't want my prayers to be a demand to God. Like, please help me do this or help me do that. I don't do that anymore. I like to think I'm going to do a more mature way about it. And the last one is social. And people who need people really are the luckiest people in the world, because we don't live in a bubble. And Deanna was right. And the fifth dimension begs us to become aware of our importance in society. Okay, and we do have a big role. And although I don't think we individually are all that important, but I think as a whole we are, because we can make the world a better place. And call me the 𝗗𝗏𝗺𝗧𝙀𝗃 optimist, okay? But I believe that we together can work. I mean, look what we've gone through lately. Look at the hatred, the strife, the racism, the insurrection that took place in January 6th. It's a very stressful time. And then we had COVID. And now we're going through another wave. My hospital has gone from, we had 0 cases, then we had 5 cases. And last week when I was on call, we had 14 cases. Now we're up to 40. In 1 week, we've gone from 15 to 40. And now we're going through social, basically social isolation. I think it's terrible. I think social isolation is horrible. At the same token, I don't want to die. And so we even work harder now than ever before to embrace us being part of a whole. And that's what social well-being is all about. So, there you have it. There's my 5 dimensions of wellness. And they're intertwined. And I guarantee you that if you embrace these dimensions and really work on them, you will become your own medical advocate. That's really what it's all about. And it's about refusing to rest on your laurels and striving always for your optimal best. Whether you have an illness or whether you don't have an illness, you can still do your best to live life. It's all about enjoying this very short journey we have called life. So thank you very much. I'd like to take any questions that people have. I kind of gave you my examples. This is a little longer than my usual, but it's a very important topic to me, so I wanted to share it with you. So please, anybody have questions? I will take them now. Okay, I have one here. So, okay, here's one. My doctor doesn't ask me any of these questions. So what do I do? Well, it's easy to say just get another doctor, but it's not all that easy, because you may have an important relationship with your doctor, and I don't think you should get rid of it. I mean, I don't believe in throwing out the baby with the bathwater. But you have to I gave you a few examples of questions so that you can take a little journal and write your own list. Well, what about my hormone? Well, what about my thyroid? Well, what about this? And what about that? Write a list. And if your doctor can't answer them, go to the internet. I'm not saying believe everything you read on the internet, but you'll find sources that can help you, support groups and things like that. So, and look for other providers. I believe, and it's all in my book, in developing a dream team. So I have my doctor, I have my rolfer, body worker, I have my physical therapist, I have my biohacker. I have a lot of mentors. I love to be mentored. And so I have my own dream team, and I think it takes a village. So anyway, that's that. Let me see what else I have here. How does your biology, genetics, okay, 5 dimensions. Okay, so like I said before, people really talk about genetics. Oh, I'm doomed. I got this gene. I got that gene. I got the ApoE, which is, a gene for Alzheimer's. I'm not minimizing genetics, but I think since we can't do anything about it, right? We can't do there's 2 things we can't do anything about: age, genetics. So what do? We try to deal with our deck of cards and do the best we can with them. When it comes to memory, same thing. Physical well-being, same thing. I have limitations. When I went through my back surgery, I have permanent nerve damage. There are certain things I can't do anymore. I can't jump up and down and do crazy things that I used to do. I was fearless. So I can't do those things now. So I try to be thankful for what I can do, and that's what you have to do. So genetics is there, but we want to emphasize the fact that lifestyle is more important. Like I said, maybe 20% genetics and 80% is lifestyle. And most of us in the longevity field really believe that to be true. Okay, what else? Um, I get sick after every single. Absolutely. Okay, that's a great question from the shrink shop. Getting sick after competition. It's funny. I didn't, but I did actually one time. I developed a back ailment after my competition. So competition, whether bodybuilding or whatever, marathon, triathlons, a lot of people will get sick afterwards because it depresses your immune system. Because when you're exercising to that degree, now we all know exercise is healthy, but it also is a double-edged sword. And if you overdo things like getting ready for competition, and you don't get sick during it because you have that mental power to keep going. Then after it happens, when it's all over, it's like I think with one time I was within 24 hours of competition, my back did go out one time when I was in Pittsburgh. And it really bummed me out. But I've had to have people with marathon runners, triathlons. In fact, we've done studies. If you look at one of the reasons I decided to give up on triathlons when I learned that after you did the Hawaii the Ironman, they did studies on people. They did endomyocardial biopsies. They did little biopsies of the heart muscle for like 6 weeks, 4 months, like 3 different serial biopsies. And they found there was permanent scarring of the heart muscle because you really aren't meant to exercise that extent. So, but I think the main thing is your immune system is depressed. Certainly after something is grueling as a competition. It's really common. Okay, how do you feel about the mental health of our Olympic athletes? Okay, this whole thing about Simone, the gymnast, I thought it was great. I think the mental health is, listen, if you're at that level and you're going for gold, I understand doing whatever you need to do to get there, but sometimes you can't. I mean, we have to always remember that we're talking about the human condition now, and it's not worth dying for. And I think what she did was, and she had to come back. So I believe in being, as far as letting the team down, leading the nation down, get over it. More important is the mental health of our athletes, our mental and physical health. So I feel that sportsmanship aside, mental health is more important. That's just my personal feeling. Okay. Sorry, this is so small. I got to read it. Okay, thank you. Someone said I'm their higher power. Well, thank you very much. And it's true. A lot of people are atheists. They don't really have a higher, but you need to have a higher power. It doesn't have to be God, or God can be a man or a woman. So anyway, thank you. That's very nice. Now, emotional well-being, like, where do I go for it? And here's the thing. If you really feel that you're stuck and you can't get your emotions out, you need to be with people. You need to seek help, whether it's a therapist, whether it's a clergy person or a rabbi. I've done other things like I'm a big believer of something called LENS, low energy neurofeedback system. And actually it's a brain wave kind of work in which you're hooked up to a bunch of electrodes, and your brain waves are they interact with a computer, a software program, and you have a facilitator there. And it's magic. I did it. I have a history of anxiety in the past, and it cured me. I was on medication, and the psychiatrist said, "Oh, you're probably going on medication the rest of your life because you've had, so much loss and trauma." Well, I did LENS, and it's like the recycle bin on your computer. It gets rid of old patterns that no longer are useful to you. Like when we go through loss and trauma, we develop patterns as a kid or a young adult to survive, because it's all about survival. But when we get older and those patterns really are not working well for us, we have to find something else, and it's hard to do it. But LENS does it for you. I had great experience to the point in which I actually have a practitioner who comes into my office once a week, and he works with patients on LENS therapy. It's not therapy. You weren't there to pontificate about your problems. You're to just your brainwaves interact with a software program, and it's magical. And it's a form of neurofeedback. So it's something great. Okay. Oh, I love these. What is your view on sleep and wellness? What is the optimal level? What about theta waves? Okay, great question. They have some really good sleep aids now out these days. And some of you heard of the Aura Ring? I want to get it, because it does heart rate variability, but I think what it does best, evaluates your sleep. And everything in wellness now really centers on sleep. We never, when I was in medical school, 4 hours of sleep. I mean, come on, and when I'm intern being on call every third night, it was crazy, the stuff that I did, but we all did it because we had to do it. We don't have to do it now. And so I think any person in the wellness field knows that sleep is so important. And thank you, Angela, it's the deep wave sleep. And that's measured, these sleep aids. It's not just the Oura ring. Oura rings are something, it's about $350 or so, and you wear it on a ring. There's a ring. There's bracelets, other aids that will help you. There's even Fitbits do something like that, but probably one of the best ones out there is the Oura ring. I think it's OURA. I've done a lot of reviews on it, but that'll really tell you your pattern, and you want to have something like the deep wave sleep should be at least, don't quote me here, but I think it should be at least 90 minutes to 2 hours. If you can get 90 minutes to 2 hours of deep wave sleep, which is, I don't know if that's delta, that's theta, or which one it is, but that's the deep wave one, then you're really doing well, because that's really rest and restoration. Because if we want to age well, we have to rejuvenate. And we have to have mitochondrial rejuvenation, and we have to get rid of cellular debris. And we do it during sleep, and it's actually during the deep wave sleep. So yes, it's really important. And it's funny, I used to drive 4 days a week to Gold's Gym from Whittier to Venice. I loved it. I used to compete, and I've had the same trainer for over 20 years. And then COVID hit, and the gym was closed. I said, now what am I going to do? And I found a gym that was private, very like 5 minutes in my office, and it's not ideal. It doesn't have all that Jolt has, but I'm not trying to get bigger at this stage of my life. I'm just trying to stay healthy and strong. And I get like an hour and a half to 2 hours more sleep every day now. That's like major. So COVID was good to me in that regard. Okay. Yes, LENS. It's low energy neurofeedback system, and I'll be glad to tell you more about it. Like I said, it's very good for things like insomnia, chronic anxiety, OCD, obsessive compulsive disorder, also traumatic brain injury. It's also for addictions, because you're putting it all out there, but you don't have to talk about it or think about it. It's magical. When I did my first session, okay, I remember leaving the office and I just started laughing. It's like I had this moment of levity that I don't normally have. It was like a non-chemical high. And I think I had about 7 sessions, and I have never needed medication since. And that's been over 10 years ago. And I've had plenty of stress to acquire medicines if I needed it. It just freed me, and sometimes we need that extra something. So there's other forms of neurofeedback, but that's something I'm very familiar with. So if anybody has questions, hit me up. It's something I think it's really important. And I like to give people options and tools, That's when I did that first symposium in 2000 about, healthy tools for the new millennium. It's like, okay, millennium, metaphor for change, and I've just grown since then, and now I'm braced enough to share it with everybody, because this is what I love to do. Okay, let's see. Any of the spiritual? Like, how do I work on my spiritual well-being? Okay, number one, when you get up in the morning, don't put your phone on for at least an hour. Okay, like, it's very important. It's not easy to do, right? Because we should be like faxing and Skyping and Zooming, and more is expected of us today than ever before, and it's not a good thing. And I think with COVID, since we got even more into screen time, it's not good. So I try to. I'm not great at it either. I'm not going to look at my emails. I'm not going to look at my messages. And it's not always easy to do. I'm not perfect at it. And then before you go to bed, if you have any problems with sleeping, I can sleep on a dime, but if you have any issues with sleeping, you got to get rid of the screen time, because that'll definitely put a dent in your sleep. And get and meditate. We're going to be talking about breathing and meditation in a few weeks, but that's going to be very important. Is create a practice, a time for yourself. That's how I do it. Good. Let's see. Okay. Well, I think we pretty much used up the half hour to make sure we did everything. Good. Well, it's 7:30, so we usually stop on that time. Thank you so much. This is really an important topic for me, and it's in my book that will be coming out in a few months. I'll tell you more about the book as we get closer to it. But I appreciate your tuning in. And by the way, if you watch any of my videos, if you could please just check the like button, because there's an algorithm involved and it does kind of help increase my audience or whatnot. So yeah, and also share with people would be really important. And okay, thank you guys. We'll see you in 2 weeks. Okay, thanks so much. Have a good evening.